Capitol Report is a production of Senate Media Services.
This week, key lawmakers weigh in on the impending workforce crisis facing the state's nursing homes. And another lawmaker calls for Minnesota to join its neighbors in legalizing sports betting. Plus, a look at the Capitol through the seasons. Stay tuned for this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. The Centers for Medicare and Medicaid Services, a federal agency, has issued a requirement for healthcare workers to be fully vaccinated by January 4th of next year. That requirement has sounded the alarm for nursing home administrators and staff who recently appeared before a key Senate committee to warn of a nursing home workforce crisis.
I can't be clear enough when we say this. This is a potential powder keg with a very short fuse for long-term care. We face a scenario where we don't have enough workers to serve the seniors in our settings. And despite our pleas for help over the last several months, there are no concrete solutions, either at the state or the federal levels, to help us solve our unprecedented workforce crisis. Minnesota is not prepared for the very real scenario that we may lose thousands of additional employees from nursing homes in the next several weeks as the CMS vaccine mandate takes effect. Without immediate action to implement solutions, we face devastating impacts. And I really recognize that that's strong language, but that really is, I cannot underscore how ill-prepared we are. We know, for example, today that there are about 13 nursing homes that have 50% or less of their staff vaccinated.
So we all are struggling now from what we've created because we're being rigid. I think history is going to show that we're making a mistake, that we're not, we're creating a greater harm for people we say we're protecting. I feel like it's a tragedy for Minnesota. We're going to be sitting here with a lot of facilities. Assisted livings are going to close. I get called every week asking if I'll take a job. I'm one person in this industry. People don't want to be in it. If nobody wants to be in it, as a CEO, as a nursing home administrator, as a campus administrator for a hospital, that's at the highest level. Imagine being an aide, the housekeeper, the dietary aide. There's nobody for the jobs. We're not Dairy Queen. We can laugh when we say, oh, you're only going to get drive-through today because we don't have enough staff to cook. Well, it's a soft serve cone. I'm taking care of people 24 hours a day. This is not drive-through. We need people.
We agree that the lowered bed capacity and the need for staff is an absolutely urgent priority. So we are, all of my team has been working pretty much 7 days a week to sustain nursing facilities and think of ideas for helping them meet the critical needs of their residents. We want to see nursing facilities remain open. We want to see them continue the important care delivery work. The post-acute system is a vital part of the care system, and we care about these providers and the workers and the residents. I can't guarantee an outcome, but I can promise an extraordinary effort is being made right now, and I'm committed to meeting with you today, tomorrow, this weekend, whatever we need to do.
Senator Jim Abeler is the chair of the Senate Human Services Reform Committee, and I spoke with him about the workforce crisis. Compelling testimony was shared during your committee about the situation that nursing homes and long-term care facilities are finding themselves in. Do you agree that this is a potential powder keg with a short fuse?
Oh, thanks. And Shannon, as great as it is to see you again, I'm sorry we have to get together and talk about this. This is one of the biggest looming crises we've had in a long time. It is indeed the perfect storm where a very rickety long-term care system has been met by COVID and now met by a mandate from the federal government. And together, it could actually result in grandma being in a minivan outside a hospital, waiting to be in where there's no bed to put her. And that is what's before us here. And the date that this is all gonna come to a head, if it does, is gonna be December 5th, when people have to have their first vaccination. And that is not the cause of all this, but it adds on to it. And it just provokes a very, very challenging time.
To that end, you spoke with Department of Human Services Commissioner Jody Harpstead this week. Did that conversation lead to any potential pathway through this?
Well, first I want to commend her for her engaging attitude toward us in the legislature and an effort to collaborate and find a way to do a partnership. I should just have to add in stark contrast to the governor, who cannot find his way to return my calls when I'm trying to offer him advice about how to get through this. Last year I gave 13 outreaches and finally got him to call back after 4 months. And the way to solve this is in the trenches in a collaborative process with people working together. And with all respect to him, one man against COVID is not actually succeeding in Minnesota. And so thanks to Commissioner Harpstead for reaching out to try to be a model about how this could well be done. And so part of the problem is money, part of the problem is workforce, and part of the problem is just the weakness of the whole industry. And so the commissioner and the governor are going to put $50 million to nursing homes to let them spend as they like to shore up their challenges. I admire that as a good start. But the focus is not as much on workforce as I think it needs to be. There are people leaving in droves. I just talked to one of the leaders 2 days ago. 2,000 people a month are leaving nursing homes as workers out of 48,000. That can't go on very long. And it's exacerbated by people's fear and their unwillingness to take a vaccine and not be allowed to exercise their religious freedom and even have people recognize their medical exemption status. And to me, that unreasonableness is making this even more difficult. But I want to thank the commissioner for engagement and for coming up with the beginning of a plan.
So you mentioned money. If wages were higher, and this has been an ongoing conversation with the legislature, if wages were higher, would that make a difference?
Well, sure it would. But there's a lot of competition for human beings. And so hospitals are in challenge, group homes, and now nursing homes. The challenge with nursing homes is that people in there, if they're not served, are going to die. People in group homes with a disability, if they aren't served there, they'll go live with their family or somewhere else and they'll be kind of okay. Hospitals can they can defer any elective surgery, so you have to have a bad knee for a little bit longer. And they'll keep their urgent care and their critical care going. This is an industry where if a place closes, where are you going to put these senior individuals and these people with very serious disabilities? And just even the trauma of moving from one place to another is a lot. And so this is going to be the flashpoint, and this is where the attention needs to go. And if I were the king, and you should know well enough that I'm not, I'm just one legislator from R-Anoka doing my best. You got to find a way to stem the tide of 2,000 people a month leaving and try to draw some more people back and try to find a way to build careers. And it takes a focused, collaborative effort, which we could come up with, I believe, if we all can work together.
Well, I hear you saying that the potential straw that breaks the camel's back is this vaccine mandate from the Biden administration that all healthcare workers by January 4th of next year have to have the full series of COVID-19 vaccination. Senator Paul Udke suggested that the state should push back against this federal mandate for healthcare workers. But what happens if some nursing homes don't comply? And also, more importantly, perhaps, how do you balance the workers' right to make this choice against the health and well-being of vulnerable and elderly people, who could become sick?
Well, and I think first you want to step back and tout the success where we've had in addressing the infection rate in nursing homes. It has stabilized. In the beginning, it was pretty well ignored by the administration, and we spent more time worrying about hardware stores on Main Street and little gas stations, and not where all the cases were at. It was truly an epidemic in the nursing homes early on, and the effect was everywhere. And so the focus that finally got directed there by the administration has worked. And the cases coming out of nursing homes are very minimal now. And so they've got their PPE, they've got their sanitation, they've got their distancing. It's actually not the problem area anymore. And so, but You have to have bodies there. And there is no other treatment that is out there these days that somebody has to do against their will. If you have pneumonia, you don't have to take the penicillin. You would sit there with your doctor and you would sit there and consider, well, this is your situation, and they would do an informed consent time. And they would say, well, you're actually a low risk, and actually you're at a higher risk of some of the adverse reactions, so maybe you really shouldn't get this. And by the way, you already had COVID, you have a lot of antibodies. You don't even need the vaccine. But unfortunately, even the antibodies and the people that are already are pretty well immune to COVID are not even being considered. But even along the same lines, people's religious freedom and the ability to express their faith is tantamount to Minnesota and to our country. And for heaven's sakes, if you have a medical allergy to some of the ingredients, why should you be forced to take it? So if you would just do those things and people go like, oh, I'm good, I'll stay here. And then when they're going to be forced out the door against their will, they actually like doing this. The people who are left behind who are qualified workers are going to be so overloaded, they're not going to be able to hold up with the load. And this is not anti-vaccine. This is pro-informed consent. This is pro-science. This is pro-modern medicine. How do we treat people who are at risk and how do we treat them differently than those who are not? And that seems to have gotten lost in this.
I want to ask one more question about a workforce shortage, because we do have a demographic change underway. We are going to have, as a state, so many people who are older and fewer people who are younger. What is the role, in your view, of immigration in staffing nursing homes, long-term care facilities? Because historically, immigrants have done those jobs that are lower paying or jobs that more established Americans don't want, mining, factory work. You know, could immigration be a potential solution to getting our staff in nursing home and long-term care facilities?
Well, it already has been. If you look at the cadre of the workers, a lot of them are new Americans, eager to work, eager to experience the American dream, eager to be self-sustaining and to serve. And they make amazing employees. And so, absolutely. And, we have to maintain the integrity of our borders and all of that. But how do you attract more people in? This is a great entry-level work. If we can make it a career, if we can help the wages to be that they can afford it, if they can get benefits, if they can appreciate the stability of our community that they become a part of, and these nursing homes are communities, then that's absolutely part of the solution. Staving the outflow, bringing people back, and getting stability again for grandma so she doesn't wind up in a minivan outside a hospital just before Christmas. We have to have that not happen. And the answer is working together. Time for the administration to reach out, draw us all in, bipartisan, and find a way to solve this together. That's the answer in my mind, and I'm willing and excited to be a part of that.
Senator Jim Abeler, it is always so good to see you. Thank you.
Thanks. Happy Thanksgiving.
Senator John Hoffman is the ranking minority member of the Senate Human Services Reform Committee. He joins me in the studio to offer his perspective on the challenges facing Minnesota's nursing homes. Thanks for being here.
It's great to be back, Shannon. Nice to see you again.
Yes, very nice. The concern among nursing home administrators is that the federal mandate that is about to take effect that requires healthcare workers and other staff to be fully vaccinated will result in the loss of quite a lot of critical staff. In your view, will the mandate result in unintended consequences, making nursing home residents lose critical care or perhaps even nursing home closures?
I'm glad you bring that up, because we had a hearing just last week, I believe, where some folks in the industry had brought up the concerns, right? And there's a couple of things that lay out there. There's an issue of choice, an issue of informed consent. There's an issue of informed, what are you telling me? What should I be doing, right? There's still some not good guidance from people about what it is you want us to do, right? And that's what they're telling us. And so we're sitting back asking that same question. But what we do know is we have a lot of people that need to be taken care of in the state of Minnesota. Of course, it's the first time in the history that you have more people 65 and older than you do in K-12 education. And the cost of that associated to on the Medicaid side goes from $1.1 billion to $3 point some billion, right? What does that tell you is there's a huge gap. and that means we need bodies to help other people, especially taking care of other people. And so is it going to have an effect? It might, how big of an effect, but that's really not the issue. The real issue is there's 23,000 to 30,000 open positions in some of these nursing home facilities. What are we doing to change our system and change our approach on how we're going to fill those slots? So
what you're saying is that this problem that we're facing that is sort of coming to a head because of this mandate from the Centers for Medicare and Medicaid is just the tip of the iceberg. I mean, we all knew that there were workforce shortages long before this, but this is creating that critical nature of getting enough workers to care for our elderly and vulnerable people. Is more money the solution?
We do know that in the industry of home and community-based services, our Medicaid reimbursement rate for folks doesn't work. I'll give you an example. There's an organization right now, there's 12 little kiddos that are in 2 different hospitals, right? And they're ready to go home. They need to go home. But because that organizations cannot find nursing folks, nursing services people to work for them at a market rate, the youth have to stay in the hospital. Well, it's costing the system more to have these kiddos in the hospital than it is to get them home. And if that is an issue, particularly in this case, it's a reimbursement issue. Our Medicaid reimbursement in Minnesota is absolutely not on par. When if I go work for a home health agency, I'm going to make X amount of dollars. I can go across the street and work at a clinic for $10 to $20 more an hour as a nurse. Something's wrong with that system. So in one sense you're asking, is more money part of it? Yeah, it is. It's to elevate it. I'll give you another example. A senator from central Minnesota got a letter from a constituent who happens to run a personal care PCA business, right? And which we know home health care, part of their piece is a PCA. And they're starting people at $14.40 an hour because the reimbursement rate isn't where it should be. And in that same town, you can go to work at Kentucky Fried Chicken. I was in St. Francis the other day, $16 an hour starting. So it's like, money needs to be helpful in this. But the other thing is we got to talk about reform. Is our industry needing to evolve to something that it should be versus being what it has been for the last 30 years? I don't know.
So yeah, you mentioned reform and you're part of the reform committee. So the idea is hopefully that you're coming up with some reforms, but you also mentioned demographics, that there are more 65 and older than there are in K-12. And then there's the workforce shortage. So do we do it differently? How can we do it differently? I mean, just before we were talking about these buildings and these institutions, and do you have ideas on that?
Yeah, I think you talk about population is changing, yet, we in the last previous years haven't had so many new people coming to Minnesota to work in that industry. So part of it is, how do we get more people to come in to work in that industry? How do you create a career lattice or a career ladder that says, come in, work in this industry, we're going to give you credit, we're going to get you education, we're going to get you to where you want to be, right? It's kind of interesting. You look at what's the name of the big, when you buy stuff online, what's the name of that company, that big company?
Amazon?
Amazon, that's it. Amazon says, come to us. If you want to be a doctor, we'll help you go to school to be a doctor. But they're saying, come to us. That's a great incentive. If I know that I'm going to have flexibility to work when I want to work, go to school when I want to work, and still not worry about having a job, but you're going to take care of that, that's a heck of a marketing idea. And that's to get people to be attracted to go to them. Where's the innovation in Minnesota? I haven't seen it,
Does Minnesota need to make a really concerted effort to bring in more immigrants? I mean, historically, immigrants have done the work that more established Americans don't want to do. They built railroads, they work the mines, they, pick crops. Do we need immigrants to work in our healthcare and nursing care industry?
It's interesting because my grandfather, who came from Odessa, Russia, he worked on the railroads. That was his whole life, was with this little small company called Burlington Northern, and it's just like, he came in, got on that, and stayed there throughout his whole. He was a yard master when he retired. But absolutely, right? And it's like, because it's the old sociological argument of the pig and the python, right? And I just remember visually seeing as it moves through, the population is moving through, right? And so the case of now we have more people 65 and older than we have in K-12 education. Well, what does that tell you? 5 or 10 years from now, we're going to have an issue, right? We have an issue now. We knew this when we first came in 2013. Started talking about the silver tsunami. It's coming, right? Nobody was doing anything about it, right? We just kept saying it's coming, it's coming, it's coming. It's here. Not only is it here, but it's right now getting us to our face. And that's why all of a sudden you have the governor coming forward saying, $36 million. And I love this. And then he puts 2.6 or 2.5 million, directly to help bring the National Guard in to help out, right? That's not a long-term solution. It's an easy fix right now, but the long-term solution, what's the industry doing collaboratively with other people to talk about where do we need to be, where do we need to go? And sometimes you got to set aside some of your egos, and sometimes you got to set aside, well, I've done it like this for 40 years, right? What's new for me to do it? I don't know. Somebody has a good idea out there.
Well, silver tsunami, COVID, we have this federal mandate. There are workers who are saying, I'm not going to get vaccinated. I will leave my job. And in greater Minnesota, where vaccination rates are lower, this is fairly critical. In your view, did the federal government make a mistake by sort of drawing this line in the sand? Are they playing chicken with the care of people, particularly in rural areas where vaccination rates are lower?
Are they laying the egg to help build the system, or are they playing chicken? I don't know. I mean, sometimes we always wonder, is the bureaucratic response based upon a bureaucratic response, or is it based on science? And so I beg the question, if it's based on science, then we should be following science. Don't you agree? I think a lot of people say, let's follow science. If science is telling us that mask wearing is going to mitigate the chances of you pulling something in from the air, makes reasonable sense to me to wear a mask, right? My wife works in early childhood, and she's around kiddos all the time, and little kids, they're in your face, right? She's not only masked up, but she's double masked, right? Just because of the fact that you just don't know. Last year when we were wearing masks, all of a sudden we didn't get the flu. Why didn't we get the flu? It's because we weren't sucking in all that, energy and air that was out there, right? It was being filtered. So there's some science that I'm just talking anecdotally, right? But if there's science behind that, then let's follow the science. But here's the thing that I think happens in bureaucracies. And I spent 10 years of my life working in a bureaucracy, both on the state level and on the federal level. And a lot of times we will get so fixated that we don't have any flexibility. And I don't know why that occurs, but is there any flexibility within that scientific argument? Is there any flexibility that needs to be there? Well, then let's talk about that flexibility, if there is any flexibility.
Senator John Hoffman, it's always a pleasure to talk to you. Thank you.
Great talking to you.
32 states across the country, including all of Minnesota's neighbors, have legalized sports betting, according to Representative Zack Stephenson, chair of the House Commerce Committee. He recently held a news conference to announce his intention to pass a law that would give Minnesotans that same opportunity.
Minnesotans should be able to engage in safe and legal sports betting right here in Minnesota. And that's why I'm announcing today that I will lead an effort to legalize sports betting in Minnesota during the next legislative session. What worked in other states may not work here, and we have a lot to learn from other states' experiences. We also need to have a lot of conversations with people right here in Minnesota. We need to consult on a government-to-government basis with Minnesota's sovereign tribal nations. We also need to listen and work with our professional sports teams, experts in problem gaming, and many others as we develop a Minnesota-specific plan. But I'm hearing from my constituents and people all over Minnesota that they want to be able to engage in legal sports betting. And in fact, many Minnesotans are already engaging in sports betting. The fact that we don't have legal sports betting in Minnesota doesn't mean that we don't have sports betting in Minnesota. It just means that people who want to engage in sports betting do so on the black and gray markets. Relying on shady websites or digital workarounds to do what our neighbors in Wisconsin, Iowa, North Dakota, and South Dakota can all do safely and legally isn't right. It isn't good public policy. I talked to a lot of members of both chambers and in both parties. Gaming, kind of like liquor, is an issue that really doesn't follow traditional partisan breakdowns. There's a lot of support for legalizing sports betting in both chambers and frankly in both parties. So I think that we're going to have a good chance at getting this done this year. A lot of states, particularly the states that border Minnesota, have taken a brick and mortar only approach. And as I said a minute ago, I think there is some wisdom to walking before you run. Just doing sports betting is a huge change in Minnesota law. Doing mobile would be another huge change. I'm not here to close any doors today, but if you look at what South Dakota, Wisconsin, North Dakota, what these states have done, it's generally the brick and mortar approach. And I think that we should take a careful look at that.
The changing seasons provide innumerable opportunities to capture the beauty and grandeur of the Minnesota State Capitol. We close this week with a look at some of our favorite images. Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.